Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Thank you. Hi again, everyone. Time for our Community Service Report on a Thursday. Today, Muenster Memorial Hospital Day, and very happy to be joined this month by Yvonne Ambrose, a certified nurse practitioner at the MMH Family Health Clinic. How you doing?
Good morning.
It's
doing fine.
Good to see you again.
You too.
I don't think we get together to do this quite often enough, but we're going to do it today because there are some, I think, important things that we probably ought to address during the hot summer months. And I know being careful outside is important to everybody for a lot of different reasons. So I'm just going to kind of open the floor to you and let you talk a little bit about summertime safety.
Okay, very good. Yes. We have a lot of fun during the summertime, but yes, it's hot. We like to go to the lake. There's a lot of fun at the lake, and we take going to the lake kind of seriously because in Texas we have a lot of things to be concerned about. The heat, the sun, there's a lot of venomous snakes that we have to worry about, so we have to take a lot of precautions. Obviously, the first thing we have to worry about is the sunshine. Mm-hmm. We love our sun, but overexposure to the sun can lead to sunburns and eventually a lot of sun damage. So it's important that before you get out in the sun, you can put you some sunscreen on, SPF 30 or higher, 30 minutes before you get out there. And if you're going to be in the lake or your swimming pool, you put it on every 2 hours. If you have very light skin, you're going to sunburn easier. So every 2 hours, you put that sunscreen on. Overexposure over long periods of time is going to lead to, if you're not applying sunscreen and taking care of your skin, can lead to things like basal cell cancers, squamous cell cancers, and melanoma. And, of course, the other part, too, if you don't protect your eyes, you can get cataract over time, cataracts, even melanoma in your eyes. So make sure you have sunglasses that have UVA and UVB protection as well. So that... The other thing that people may or may not remember is that you need to make sure that you're very well hydrated out in the heat. If you're a jogger or a walker, or you're out there playing volleyball, tennis, and it's hot outside or very humid, that you make sure you're well hydrated. You should be drinking at least 24 ounces of fluids before you get out in the heat. If it's very hot and very humid and you're exercising vigorously, you should be drinking 8 ounces every 20 minutes and making sure that you're peeing about every 2 hours. Make sure you're keeping hydrated, because that will lead into, if you're not hydrated properly, people get heat exhaustion, and eventually if it's very hot and you get very hot, you can have heat exhaustion, and that can lead to the very serious problem of heat strokes.
Real quickly, explain the difference for those of us that don't know the difference between heat exhaustion and heat stroke.
Okay, heat exhaustion is when you're starting to get dehydrated. You might be dizzy, you feel hot, you're kind of weak. You're starting to trend toward heat stroke. Possibly, but there's time to fix it. You don't have to go to the emergency room. Heat exhaustion is a serious sign. You can treat yourself. You can take your electrolytes, like Gatorade or Powerade, something that's got some electrolytes in it. Get out of the sun, cool down, immerse yourself in some cool water or cool towels. You can pretty much self-treat yourself, make sure you're still peeing. But heat stroke is when your core body temperature gets above 104. A lot of times people will have a seizure with it. The brain has been affected and you'll start having problems with your multiple organ failure. So at that point in time, when you have a heat stroke, it's a medical emergency, and you must go to the emergency room, call 911 or whatever. You need to be treated. And heat stroke will have some serious consequences, and some people will die from that. So.
Yeah, and I've been told, and correct me if I'm wrong, that it affects your central nervous system in a way, and you could feel effects from this for the rest of your life, right?
Yeah, you can die from a heat stroke.
Yeah.
Yeah, and you can be very sensitive to heat, even from having an episode of heat exhaustion. You'll be very sensitive to heat from that point on. So you're very aware of taking care of your fluid. Make sure you're well hydrated anytime you're out in the heat.
See, I know that because I'm a victim of that from many years ago. Playing too much softball on the 4th of July will do that for you. And now I'm very sensitive to the heat. I mean, I can't stay out very long at all without getting shaky.
Yes.
And so just wanted to throw that out there, that all the more reason to take the precautions to avoid heat exhaustion or heat stroke, because you may have to put up with it as long as you live, actually.
And people that are out there drinking beer on the lake, that is going to dehydrate you very quickly. So it's more about water, adding a little Gatorade in there, and keeping yourself, making sure you're still peeing, and checking your urine, make sure your urine doesn't look dark.
Yeah, it needs
your urine
to be
clear. Yeah. So have fun, but make sure you're taking good care of yourself. People succumb to that heat exhaustion, and heat stroke, of course, is something that will kill you if you're not taking care of yourself.
Yeah.
And the other thing, of course, is snakes. Texas has a lot of venomous snakes, and sometimes they're hard to tell the difference between what's venomous and what's not venomous. You just assume they're all venomous if you get bit by one. So if you walking and you feel something bite you and you don't see it, but if you see 2 puncture marks on your leg, you're just going to assume you got bit by a snake. So, but if you see a snake, obviously try to identify it if you can. If you can take a picture of it, that's good. If someone kills it, take a picture of it for sure. But you need to get to the emergency room, wash it with some soapy water, wash the wounds, clean it up as much as you can, but you need to stay as calm as possible. If you're with somebody, have them, sit you down, lie you down, get you in a car, get you straight to the emergency room. If you're at a place where you need to have an ambulance take you, then call 911 and have them pick you up. But it's considered a medical emergency. Don't waste any time. You don't do anything to it. Just wash it. Stay calm. Don't walk around any more than you have to, and get to the hospital and let the medical personnel go take care of you from that point on, because you don't need to be cutting it with a knife. That's an old misnomer. Don't be putting a tourniquet on it either. You could apply maybe a little ice on it to reduce the amount of venom that's going to move around in the around the area that you were bitten. And in the leg, it's the worst part, because that's you walk in on your leg and there's more circulation, so the venom is going to be moved around a lot more there. So.
Well, I think that's great advice. We certainly have seen an upturn in snake bites this year, it seems, and particularly I know a lot of copperheads have been sighted, and there have been some bites, as well as one just over in Muenster last week, I think. There's a lot of that going on, so I think it's important to bring that out, and I'm glad you did that. It's just important this time of year, really all times of year, but in the summer, it's just so important to take care of yourself. if you spend any time at all outside.
Yes,
Yeah,
exactly.
And wear long sleeves and long pants if you can, but if you're like me, you can't stand that.
Yeah.
So
And a wide brim hat if you're
Yeah.
outside, and all that.
yeah, all that good stuff that most of us go, it'll never happen to me. Well, trust
It
me,
can happen.
it happens to anybody. So
Yeah.
do remember that.
All right.
Yvonne, out of time. Thank you
All
so
right,
much.
well, thank you, Dee. I enjoyed it, and maybe I'll be back again.
Well, I'll make sure that happens. How's that? All right. There you go. She is Yvonne Ambrose, certified nurse practitioner at MMH Family Health Clinic in Muenster. And that'll do it for our Thursday community service program here on KGAF.